Hello, Assalamu alaikum. Kidneys are two fist-sized intra-abdominal organs which functions to make urine, produce renin to control BP, and red blood cell assembly by forming erythropoietin. Renal cell cancer is a cancer that originates in the lining of proximal convoluted tubules. It accounts for nearly 85% of all kidney cancers. The most common type of renal cancer is a clear cell renal cancer. The most latest WHO classification categorizes rest of the renal cancers as follows: molecularly defined, metanephric, mixed epithelial and stromal, renal mesenchymal, adults, pediatrics, embryonal neoplasms, miscellaneous, and others. The clinical presentation of renal cell cancer is variable, while a small minority presents with the classic triad of hematuria, renal mass, and back pain. This is usually a late finding. It might come across as an incidental finding on routine image scanning for something else. In fact, to everyone's surprise, a debilitating spinal back pain only might be the first red flag. Other findings may be loss of appetite, weight loss without trying, general feeling of not feeling well, low grade fever, and bone pain. The risk factors for renal cell cancer are tobacco smoking, positive family history, obesity, hypertension, chronic use of over the counter pain medications, having certain genetic conditions, chronic dialysis, chronic hepatitis C infection, sickle cell disease, use of carcinogens. Diagnosis is by detailed history taking, physical examination, imaging studies, biopsy, PET scan, baseline labs. The staging is done by TNM staging, AJCC, and Robson staging systems. Treatment depends on overall general well being of the patient, the current stage of cancer. Doc's discretion include nephrectomy, chemotherapy, radiation therapy, immunological therapy, arterial embolization, cryotherapy, or surveillance. Anti angiogenesis treatment is the mainstay for recurrent and metastatic disease. The upcoming research is on cancer vaccines, immunomodulatory drugs, non myeloablative allogenic peripheral blood stem cell transplantation, magistrol, and anti estrogens. Allah Hafiz. Do take loads of care of your friends and family.